I'm here to speak about an upcoming conference, the inaugural conference for the Hofstra Center for Bioethics, and the conference will be focused on the ethical implications of the use in life science, medicine, and healthcare of a related set of technologies that we refer to as the Internet, cloud, apps, and social media, ICASM for short, ICSM. The conference is designed to address across a broad spectrum the ethical implications as well as legal and social implications, because those three things go together, ethical, legal, and social implications. The LC, so to speak, implications of the use of Internet, cloud, apps, and social media in the spectrum that covers life science, medicine, and healthcare. Examples of what we're talking about would be in a medical school, the use of an app on a tablet computer for helping medical students learn anatomy. At the same time, in the hospital that medical school is affiliated with, you may see doctors using tablet computers to register vital signs and other notes that they are taking about patients. At the same time, the patient may be wearing a device that may be implanted or on the patient or on the surface of the patient's skin that's monitoring the patient's vital signs, and that's being fed into a system that again is using Internet, cloud, and apps to make it work. Taking that example further, patients, after they've left a hospital or another setting where care is being provided, patients themselves, in the comfort of their own homes, may be wearing or have some sort of device implanted in them that is registering vital signs and communicating those vital signs thousands of miles to a bank of trained specialists who are watching those vital signs. There are all sorts of social media networks that have emerged in the last several years where patients who are suffering from a particular disease or other condition can communicate with one another and help each other cope with the symptoms and problems that disease or condition brings to them. The four panel sessions will focus on the use of Internet, cloud, apps, social media technology in the context of patients. How are patients using this technology? How can they benefit from it? A second session will focus on the overall implications of this technology for setting healthcare policy. A third session will focus on the use of this technology in the provision of medical care, a clinical setting. And the fourth session will focus on how this technology will be used for the discovery, development, and dissemination of new medical products and new therapies. The luncheon address will focus on how this technology entwines with the field of genomics. And the dinner address will become more philosophical and will focus on how all of this fits into a broader social and political setting. Anyone who is affected by life science, medicine, or healthcare, which basically means virtually everybody. Certainly medical school students, certainly law school students who are interested in this field, physicians, healthcare administrators, policymakers, and people involved in healthcare insurance and payment systems and healthcare administration generally. It's also educators. And I'm not just talking about college professors. I'm talking about primary and secondary school educators as well. In order for this technology to really help, it has to be understood by everyone